You take something like 20,000 breaths every single day, and most of the time, we don't give a single one a second thought. But what if that automatic, unseen process is secretly driving, well, everything, from our mood to our physical health? Today, we're diving into how our breath is this powerful and frankly overlooked engine for our entire well-being. So let me ask you this. Do any of these sound familiar? Feeling anxious, just totally wiped out, maybe even getting some scary physical stuff like chest pain, dizziness, or that weird tingling in your hands? It can send you on this endless loop of doctor's visits and tests, right? But what if the culprit behind all of it is something as simple and as fundamental as the way you breathe? Well, it turns out there is a name for this. It's often called breathing pattern disorder, or BPD for short, and a lot of experts are starting to realize it's basically a hidden epidemic. It's this condition where our dysfunctional breathing habits create this whole cascade of very real, very disruptive symptoms, both in our bodies and in our minds. Now, what's really fascinating here is that this isn't some new fad diagnosis. Not at all. For over 100 years, doctors have been documenting patients with these exact same symptoms. In fact, some medical historians think that famous figures like Florence Nightingale and even Charles Darwin might have suffered from what we now call chronic hyperventilation. It was just mistaken for heart disease back in their day. And this long history of just not quite getting it is so interesting because the name just kept changing with the times. Back in the 1870s, it was called soldier's heart. Fast forward to the 1970s, and it got this much more stylish and kind of bizarre name, designer jeans syndrome. Seriously, probably because super tight pants were literally squeezing people and restricting their ability to breathe properly. Today, we've landed on the more clinical terms, hyperventilation syndrome or breathing pattern disorder. So why is it so often missed, even today? Well, just look at this list. The symptoms are all over the map, hitting nearly every system in the body. You could have neurological stuff like dizziness, cardiac symptoms like chest pain, or mental fog that makes it hard to concentrate. With a list this diverse, it's really no wonder that so many people get told all your tests are normal and are left feeling like it's all in their head. Okay, so how does this actually happen? To really get how breathing can go so wrong, we first have to understand the mechanics of how it's supposed to go right. And that brings us to the body's true unsung hero, the diaphragm. Most of us, if we think about the diaphragm at all, we just think of it as a breathing muscle. But it is so much more than that. It's a total superstar, a real triple threat. Of course, it's our main engine for breathing, but it's also a critical postural muscle for your core stability, and it even plays a visceral role, helping out with everything from digestion to circulation. The key thing to get is that these three jobs are completely linked. And that leads to this super simple but crucial rule: structure governs function. Your posture and your breathing are inseparable. They're a team. If you change one, let's say you spend all day slouched over a keyboard, you are absolutely 100% changing the other. Poor posture literally gets in the way and blocks the diaphragm from doing its main job. A perfect example is this really common posture pattern. You can see it here. The muscles in our chest and upper shoulders get super tight, while the deep muscles in our neck and mid-back just get weak and lazy. This imbalance physically pulls our head forward and rounds our shoulders, you know the look. That posture makes it almost impossible to take a good, deep breath, and it forces us into that shallow, stressful upper chest breathing pattern. And this really creates two completely different ways of breathing. On one hand, you've got the ideal way. It's through the nose, it's powered by the diaphragm so your belly actually expands when you breathe in, and it's quiet and efficient. Then you have the dysfunctional pattern, often through the mouth, way up high in the chest, using all those extra neck and shoulder muscles that shouldn't be involved. It's stressful, it's inefficient, and it is the root of the entire problem. But wait, it's not just a mechanical problem. That inefficient breathing pattern kicks off this powerful and seriously disruptive chain reaction in your body's chemistry. So let's shift gears and look at the chemistry of what's happening inside your blood. This quote just nails it. How we breathe and how we feel are intimately conjoined in a two-way loop. Think about that. It means our breathing and our feelings are locked in this constant feedback cycle. Feeling anxious can make you breathe poorly. And, as we're about to see, breathing poorly can absolutely make you feel anxious. Okay, so here's the key piece of the puzzle, and it's something most of us were taught wrong in science class. Carbon dioxide is not just a waste product we need to get rid of. Your body actually needs to keep a very specific amount of CO2 in your blood to regulate critical things, like how excitable your nerves are and how much blood flow gets to your brain. It's a vital regulator. And that brings us to this vicious cycle. It all starts with some kind of stressor. That stress makes you shift into that upper chest breathing, and you start to overbreathe, blowing off way too much CO2. Your CO2 levels in your blood then drop. That's a state called hypocapnia. This is what causes those scary neurological symptoms, the tingling, the dizziness, the brain fog. And then your brain feels those symptoms and interprets them as a new threat, which makes you even more anxious, which makes your breathing even worse, and around and around and around you go.
But here's the really good news. You can break this cycle. You absolutely can. Because breathing is the one part of your automatic nervous system that you have direct, conscious control over. So let's talk about the path forward, about how to reclaim your breath.
So what are we even aiming for? What does normal look like? Well, a normal resting breath is usually somewhere between 10 to 14 breaths a minute. It's through your nose, it's diaphragmatic, meaning your lower chest and belly expand, and the exhale? That should be totally passive and effortless. The funny thing is, when you're breathing correctly at rest, you shouldn't even notice it's happening. Restoring this healthy pattern isn't some big, complicated secret. It really just follows 4 basic steps. First, you just have to become aware of your current habits. Then, you learn to consciously relax those muscles that are always overworking, your jaw, your shoulders, your chest. Third, you actively re-educate your body on how to use the correct pattern. And finally, you work on integrating that new, better pattern into your everyday life. And if you're going to remember just one thing from all of this, please make it this simple mantra. The absolute core of healthy breathing is nose, low, and slow. Breathe in through your nose, breathe low into your belly using your diaphragm, and do it at a slow, relaxed pace. That's it. It's a simple idea, but it's an incredibly powerful framework. So the real takeaway here is this. Your breath is your handle on your own nervous system. It is a tool that is with you, always, ready to be used to shift how you feel both physically and mentally. The only question left is, how are you going to use your next one?